Cystic fibrosis. Cystic fibrosis is a severe monogenetic disorder that damages the lungs, digestive system, and other organs of the body. It is usually characterized by symptoms including a persistent cough with thick mucus, exercise intolerance, repeated lung infections, poor weight gain and growth, greasy stools, and chronic constipation. While most people with cystic fibrosis are still able to attend school or work, it is a progressive disease that requires daily care. Additionally, it requires consistent, regular follow-up with a doctor every couple of months. Any changes in symptoms may require immediate medical attention. This disease also puts patients at risk for a variety of other diseases and complications, including respiratory failure, nutritional deficiencies, diabetes, liver disease, infertility, dehydration, and mental health problems. Many of these complications are severe and require urgent treatment. Cystic fibrosis is the result of a genetic mutation in a gene that affects the cystic fibrosis transmembrane conductance regulator gene, located on chromosome 7. This gene regulates the movement of salt in and out of the cell. This mutation that causes cystic fibrosis results in the mucus in the body to become thick and sticky, causing problems in the respiratory, digestive, and reproductive systems. The CFTR protein helps to maintain the amount of salt and water on the surfaces of the body. CFTR is an ion channel protein. It moves chloride ions from the inside of the cell to the outside of the cell through its center. Once these ions move outside of the cell, they attract a layer of water. This water forms a thin layer on cilia and allows for sweeping motions, resulting in the movement of mucus. Without this water layer, cilia become flattened from the thick, sticky mucus and are no longer able to move the mucus, resulting in many symptoms of cystic fibrosis. Here are some common myths of cystic fibrosis debunked. Cystic fibrosis is contagious. This disease is genetic and is therefore not contagious. Cystic fibrosis is hard to diagnose early. Hospitals now screen infants for cystic fibrosis. Early diagnosis and treatment can help avoid any major complications. Cystic fibrosis is a disease of childhood, and people often die young. Most of the current cases of cystic fibrosis in the U.S. are actually adults. With early diagnosis, people with cystic fibrosis can now expect to live well into adulthood. Cystic fibrosis only affects the lungs. Because it affects mucus and fluids in the body, as it progresses, it gradually affects other organs beyond the lungs, including the pancreas, liver, and many more. While there currently is no cure for cystic fibrosis, treatments can help manage symptoms and reduce complications, making it easier to live with the disease. Common treatments may include oxygen therapy, a feeding tube, bowel surgery, lung transplant, and many more. New drugs and research in genetics provide a promising future for cystic fibrosis patients.